Hello guys, welcome back to my channel. My name is Pharmacist Oluwafuntoborokini, and in today's video I'll be talking about the non-hormonal methods of contraception. In my last video I talked about the hormonal method, so in this video I'm going to be covering the non-hormonal methods. If you're yet to subscribe to my channel, welcome to my channel. I hope you do subscribe today. If you're a returning subscriber, thank you for coming back. I hope you do like this video at the end of it. Now let's get to it. I defined contraception in my last video as the various processes involved in preventing a pregnancy. So I talked about the hormonal processes that are involved in preventing a pregnancy, and in this video I'm going to be talking about the non-hormonal processes involved in preventing a pregnancy. We have the barrier method, the withdrawal method, the intrauterine device, that is IUD. We also have sterilization, we have safe period calculations, and there are other methods like spermicides that I'm not going to talk about. I'm just going to talk about 5: barrier method, withdrawal method, IUD, safe period calculation, and sterilization. We have the barrier method, which is the use of condoms. We have male condoms and we have female condoms. The condom is a thin fitted tube that is worn over the penis, that is the male condoms, while the female condoms are fitted into the vagina. The aim of the condom is to prevent the sperm that is being released from the penis from getting into the vagina, that is keeping the sperm and the egg apart. This method not only prevents pregnancy but also prevents the transmission of sexually transmittable diseases, that is STDs. In a case where there are concerns for STDs, it is better to use the barrier method, which is the condoms with other methods of contraception. If used perfectly every single time, condoms are 98% effective. But as humans, we are not perfect, so most of the time it will not be used perfectly. So we have about 85% effectiveness in this case. So about 15 out of 100 people using a condom will still get pregnant. I'm just going to briefly talk about how you can effectively use a condom. You have to wear the condom the whole time from start to finish to prevent any mistakes. You have to ensure that the condom is properly rolled on to the penis. That is, in the case of male condoms, you have to ensure that the condom is properly rolled on before any skin-to-skin genital contact. You have to ensure that the condom is not expired. A lot of people do not check the expiry dates of condoms. You must make sure that your condom is not expired. Then in the case of risks for STDs, you have to make sure that you are combining the condom with other methods of contraception. The best way to use a condom is with another form of birth control rather than depending solely on the condom, which may fail. Why choose a condom? First, it prevents pregnancy, it prevents STDs, it allows sexual spontaneity. So whether you're on any birth control or not and you wish to have sex, you can always use a condom. For people who do not have sex often, condom is a good choice for them because they may not go for any birth control method due to the fact that they don't have sex often. But when they choose to, or when the situation arises, they can always go for a condom. Another very good another very big advantage of using a condom is the absence of side effects. Unlike the hormonal options, condoms do not have side effects, except maybe in some rare cases for people who are allergic to some types of condoms. But normally, a condom does not have side effects. A few things you may not like about condoms. One is that it may fail if it's not used properly. Like I said earlier, due to human error, one can make the mistake of still getting the sperm into the vagina despite using a condom. So a condom could fail due to human errors. 2 is that it may reduce sexual satisfaction. And 3rd is it may tear if it's expired or if it's used over a long period of time or due to size. So something may cause the condom to tear, and in that case it will fail. In case a condom tears or you feel like you have made a mistake during the usage, the best option is to employ an alternative method of contraception, like the emergency oral contraceptive pills. The second method I'll be talking about is the withdrawal method. It is also referred to as coitus interruptus or the pull-out method. This is simply the act of getting the penis out of the vagina in time before ejaculation occurs. It is a way of preventing pregnancy by keeping semen away from the vagina. This method is a very risky one, as the period of ejaculation, or the time of ejaculation, is the peak of sexual pleasure. So it takes discipline to be able to get it out right in time before ejaculation occurs. Also, there may be some escape of sperm in maybe the pre-cum before ejaculation occurs. So this method is also not perfect. The withdrawal method is only 65% effective, as there may still be some escape of sperm into the vagina one way or another. Why choose this method? Number one is that it is easily and readily available. It is better than none. It is better than not employing any other method of contraception if you do not want to get pregnant. Now, what are the risks of the withdrawal method? The number one risk is that it disrupts sexual pleasure, or it may disrupt sexual pleasure. Like I said earlier, you have to pull out at the peak of sexual pleasure. So this method may disrupt sexual pleasure. It may fail, as it is 65% effective. It requires certain precautions in cases of repeated sex. For example, if two people have sex and they are using the withdrawal method, before they go for another round of sex, you have to clean the penis with water. You have to clean it off to make sure that there is no sperm left on the penis. Then you also have to urinate. If ejaculation is not properly timed, it may breed fear, like the fear of pregnancy. In case you're not sure that you have carried out the withdrawal method properly, it is better to employ another method of contraception, like the emergency oral contraception or the IUD, which I'm going to be talking about next. The third method of non-hormonal contraception I'm going to be talking about is the IUD, Intrauterine Device. This method, among the non-hormonal methods, is the most effective method, as it is more than 99% effective. That is, it almost doesn't fail. The copper IUD is a T-shaped device with a stem wrapped in copper coil. It releases copper ions into the uterus, which makes it an unsafe environment for sperm. That is, it is unhospitable to sperm. Sperm cannot live in that environment. This causes the sperm to be unable to fertilize the egg, and of course pregnancy will not occur. The IUD requires a health professional for insertion and removal, and this may cause a little discomfort or a little pain or a little risk of infection, just a little. And apart from this, it is safe and it is very, very effective. The copper IUD prevents pregnancy as soon as it is inserted, unlike the hormonal IUDs, which I talked about in my previous videos, which requires about 7 days or more to start working. But the copper IUD will start working immediately. So it's also a means of emergency contraception for someone who was raped or who had sex and wants to prevent pregnancy that is already more than 4 days. IUD is a very good option. To learn more about the hormonal methods of contraception, you can visit my other video about this via the link above or below. The copper IUD is not recommended if you are allergic to copper, if you have Wilson's disease, or if you have a bleeding disorder. Apart from this, it is very safe for you. Copper IUD can be effective for up to 3 to 12 years depending on the brand. There are brands that are effective for up to 5 years. There are some that are effective for up to 10 years. There are even brands that can be effective for up to 12 years. Why should you choose this method? It is one of the most effective methods of contraception, both hormonal and non-hormonal. It is one of the most effective methods, and it can be easily reversible. You don't have to worry about a pregnancy for a very long time, even for up to 10 years. Another advantage of this method is that you do not have to deal with hormonal side effects, though sometimes it may cause heavier, longer periods with a little cramping, but this will not be as serious as the hormonal side effect. Why you may not like this method is because it requires insertion and removal by a healthcare professional. It's not something that you can do by yourself. The fourth method I'll be mentioning is the safe period calculation. This is a process of knowing your menstrual cycle, knowing exactly when you'll be fertile and when you will be unfertile, like knowing your fertile days and your unfertile days in your cycle calendar. I have another video on this. It is very detailed, and I'll be posting the link above or below for you to check it out and learn how to calculate your safe period. When you have sex during your safe period, you will not get pregnant. You will most likely not get pregnant. And when you have sex during your unsafe periods, you will most likely get pregnant. Finally, I'll be talking about sterilization. We have sterilization procedures for men and we have sterilization procedures for women. For women, it is called tubal ligation, and for men, it is called vasectomy. Tubal ligation involves sealing off the fallopian tube to prevent it from carrying the egg and the sperm down into the uterus. Fertilization takes place in the fallopian tube, and from there, this combination of egg and sperm is transferred into the uterus. When the fallopian tube is sealed, this cannot happen and pregnancy cannot occur. In rare cases, there are cases of ectopic pregnancy, but they are not very common. So this is something that could happen in cases of tubal ligation, though not common. Vasectomy is sealing off the vas deferens. The vas deferens is one of the tubes that carry sperm into the semen. So when the vas deferens is sealed off, this will not happen. Sperm will not be carried into the semen, which will prevent pregnancy from occurring. Vasectomy is generally considered to be safer than tubal ligation because it only requires the use of local anesthesia, and ectopic pregnancy cannot occur in vasectomy. We have come to the end of this video. If you have followed through this video and the last one I made on the hormonal methods, you will easily be able to decide which method is good for you. I've talked about the pros and the cons. It's left for you to decide. If you did watch this video to the end, definitely you liked it. Please click on the like button. If you're yet to subscribe, please subscribe to my channel, and do not forget to click on the notification bell so you can be notified whenever I upload a new video. Thank you for watching. Bye guys. Bye.